Well, as if having a baby isn't enough for new moms to deal with, there's this thing called postpartum, right? There's a transition that our bodies go through after having a baby, and we can use all the love and support we can get, and you can find that here at Women's Health Arizona. I am with Dr. Karen Estrada, OBGYN, and nurse midwife Karen Ivancic. Okay, this is a topic that's a pretty hot topic amongst new moms, right? There are so many changes that our bodies are going through after baby. And then we've got a baby, right, to deal with on top of that. Dr. Estrada, I want to talk a little bit about when women come in postpartum. I'm guessing mental health is probably a big topic and a big topic of conversation.
Yeah, and so it begins even before we start the conversation. So at Women's Health Arizona, when you get checked in for your postpartum visit, you'll complete a depression screening.
Oh,
actually.
Interesting.
And so it's pretty seamless. You fill out the questionnaire, and that helps us identify risk factors for patients and who might be at greater risk of postpartum depression.
Isn't it normal?
Yeah, so some postpartum blues are normal in those first 2 weeks. You have a new role, a new person that you're taking care of.
Yeah.
But there's definitely a point of transition where it becomes less functional. And so that's where we try to tease out what is functional and what is dysfunctional for patients.
And because the two of you collaborate a lot, I'm sure you're communicating with each other and maybe sense that, you know, early on, you know, to keep an eye on certain things. So there's the mental side of it. And then Karen, there's the physical side of it. Correct. You know, we've got a new baby. Our bodies are changing. Yes. What are some of the tips and suggestions that you give your new moms in order to keep them as healthy and as viable as possible?
Yeah, I think that the biggest tip that I can give is to accept support as much as possible, to really build your circle and to start that prior to postpartum ever beginning, really making sure you have that in place ahead of time.
And new moms have a tendency to, well, moms in general, put ourselves last, right? And that, this is not the time to do that when you have a new baby, right?
Correct.
Because we're still healing.
Yes, absolutely. Also just focusing on hydration and nutrition, rest, which can always be such a challenge with a newborn and breastfeeding. Right. And speaking to your provider, I can't say that enough. We are here to help and support, and we might have some ideas and some resources that you've not thought of. And so really important at your checkups to bring up concerns and be honest about what you're feeling and going through.
Yeah, that's, and I'm guessing that is probably something that you have to sense, right, as providers. But knowing what you're dealing with, even before the baby is born, I'm guessing, is that relationship and getting to know the two of you, how important that is to you and your patient.
Yeah, and then Karen might also tell me, hey, I've got this mom, I've been following most of her care. She's someone that has a history of depression, not currently on medications. We talked about this. And so one of my roles as a physician in collaborative practice is to talk about the risks and benefits of medical management for these symptoms, which moms might be hesitant to do.
Well, and because moms are busy, new moms are busy, and it's easy to put off these appointments. What would you tell a new mom, Karen, who's like, oh, I don't have time to come in, I've got a baby, I've got maybe even other little ones at home?
Yeah, whatever you have to do, make the time. It's really an important tenet of making your postpartum period joyful. That's really everything that we talk about and focus on during our appointments is how do we make this the best experience for you so you're enjoying this time with your baby as you're recovering.
Oh, I love that. That's super important. And what would you tell moms who are, you know, too busy?
I'd love to see your children at your visit.
Yes. Please bring the baby.
Bring them all.
Yes.
The other benefit of being in a big family tree like Women's Health Arizona is that if I have a patient that transitions in another area, I can call up that other doc, that other midwife, and say, hey, I've got this support network. I have this patient coming to you. She's moving. You know, she needs these additional layers of support. What can I do to get her set up for success?
I love that. That's what we all want to hear, that we've got a village behind us. Thank you so much. Here's more information. Women's Health Arizona has locations across the valley and Prescott. You can book online at womenshealthaz.com.